The chiropractic service that you may have gotten years ago is likely not anything like what is available now.
It's true, and Dr. Alan Cross from Tucson Chiropractic Spine and Injury Center is here to share his expertise when it comes to our spinal health. It's a pleasure to have you here.
Good morning.
It's such a big part of our body, isn't it? And it's something that a lot of people don't often really pay much attention to, but we really should. And your practice specializes in finding missed injuries. Elaborate on that a little bit.
Yeah, so over half the people who get injured in a collision are still in pain 2 years later, studies show. And a lot of it is because they have missed injuries. You have to shoot specific x-rays to catch the ligament injuries that there are in the neck. And so, unfortunately, a lot of them don't. And you'll see on this video right here, this is actually me. And right where the arrow is pointing, if you look closely, you can see that the one bone is slid forward on top of the bone below it.
Yeah, you can see that.
The ones above it are lined up nicely. That is about 4 millimeters of translation, and that is actually a permanent injury. And anything over 3.5 is considered an impairment. And so if that impairment is enough to cause you a disability means an impairment that's affecting your life or work, that is considered an 8% total body disability according to the AMA guides. It used to be 25%, but the new guide says 8%. So unfortunately, a lot of doctors don't test for it, and then even if they do, the attorneys don't understand the importance of it. Because let's say you have someone who's 25 years old who has a job where looking down a lot, let's say it's a jeweler or someone like that. The AMA and the Bureau of Labor statistics show that people with a disability work less hours and work less years in their lifetime. And so a good attorney should be able to argue, if there's sufficient insurance coverage, this person is going to lose this amount of income over the rest of their lifetime, and they should be compensated for it. But unfortunately, a lot of them just don't even understand it, or the ones I've spoken to don't think juries in Tucson would understand it.
Which is a shame.
Yes, it is a shame.
And you know, some of these things, like you said, aren't caught on regular x-rays.
Correct. And
so you're the expert when it comes to this, especially when it comes to the neck. And you say that your approach to healing the neck is a little bit different, right?
Yes. So I use a technique called Atlas orthogonal. And the concept is that if you look at someone straight on in space, their head should be 90 degrees to their atlas, which is the first bone here in the neck. And that allows flow, as you can see on the chart, that the spine on the left, there's a kink at the top of the neck. That can impede blood flow into and out of the head, spinal fluid flow. And so what we do is we get specific x-rays and we find out which way your atlas is tilted and twisted. And then we shoot it into place with a percussion instrument. You don't even feel the adjustment. But I've had numerous patients after we adjust them and they sit up and they say, I feel blood flow back to my head.
Oh my gosh.
Or I feel my head drain. It's very effective for folks with migraines, other types of headaches. And also, it's a very important area because the brain stem sits right there and it controls your blood pressure, your breathing, your pulse, all kinds of things. And so if that area is kinked up and the spinal fluid is not flowing through there, you can get waste products build up in there, and that affects the nerve conduction.
Well, again, going back to missed injuries and how much they could actually be affecting you and impeding you if you don't take care of them properly. And so that's the upper body, the neck. But let's talk about knee pain. You actually take a non-surgical approach to addressing that, right?
Yes, we do, because knee surgery should be avoided at all costs. A good surgeon will tell you that. You should start with the most least invasive treatment for the knee. And so up to 1/3 of people who have had knee replacements still experience chronic pain. So what we do is we use a knee traction table there. And what it does is it just tractions the knee joint apart. We use that along with electric stem and some laser therapy. And it's about over 90% effective for folks with knee pain. And so we've had really good results with that.
And you should definitely get a second opinion, right? Because when we talked about the neck, again, sometimes these things aren't caught. And you do that. And you said that people can come in and bring their x-rays that they've already had done before, but they think, you know what, this isn't really fixing the problem.
You should always get a second opinion, especially if you're considering having any kind of surgery.
Right, and something I think that people often overlook is the relief you feel afterwards, right? That's what we're aiming for, is feeling better, feeling like yourself again. And also the adjustments, they feel good too. I've had them done, and certainly it's something you should check out. So pleasure to have you here. Thanks for the great information.
Thank you very much.
Thank you,
Appreciate
Nice
it.
to see
doctor.
you.
And right now you can get a free consultation, including a review of any x-rays or MRIs that you bring in. For more information, you can check out TucsonAtlas.com, or you can call them at 520-797-4177.